Hello, everybody, and welcome to our Heart Talks webinar. I'm Selena Gore, the CEO of WomenHeart. And to those of you who are new to us, WomenHeart is a patient-centered organization that provides support, education, and advocacy to women living with or at risk of heart disease. Thank you for being with us today. Now, before we get started, I'd like to thank Pfizer, our sponsor for today's webinar. In celebration of National Immunization Awareness Month, we are here today to talk about vaccines. While images of babies and young children and older adults may come to mind when we hear about vaccinations, the fact is that women with heart disease of any age are more susceptible to vaccine-preventable illnesses than the general population. So it's really important to know what vaccines you need and when you need them based on your health and your diagnosis. And this is true even if you're under 65 years old. Of course, we know about the COVID vaccine and boosters, which has done a lot to enable us to get back to some semblance of normal in our day-to-day lives. And now, as we enter into the fall, we're coming up on flu season, so many of us will need to make sure that we're up to date on those flu vaccines. But women with heart disease also need to consider their vulnerability to other diseases like pneumococcal or shingles, for example, that have vaccines to prevent or lessen the severity of these conditions. Unfortunately, vaccine uptake among adults is low, and it's even lower for communities that experience other health disparities, including women of color. This is why it's so important not only to spread the word about who needs vaccines and when, and this is in order to stay healthy, but we also need to come up with solutions that address the barriers to vaccines that are causing the disparities. And fortunately, we've recently had some great policy wins in this area, which we're going to be talking a little bit about today. So let's get started, and let me note that while our speakers are presenting, you are free to put questions in the chat, and I'll do my best to get to everyone today. So our first presenter is no stranger to the WomenHeart audience and to the broader cardiovascular community. Dr. Martha Gulati is on our Scientific Advisory Council and is a preventive cardiologist. She recently became the Associate Director of the Barbara Streisand Women's Heart Center at Cedars-Sinai Medical Center in Los Angeles. Thank you so much for being with us today, Dr. Gulati.
Oh, it's my pleasure to be here. And I think this is such an important topic, and I'm so glad that we're actually covering this. So we can go to the next slide. And I have no disclosures. And then next slide. So why are vaccines important? We've spent this entire time since the pandemic started talking about vaccines in many different ways. But we need to go back to the regular vaccines and talk just about them, the things that we had always been recommending even before COVID had started. Vaccines are really important for people living with heart disease. Heart disease makes it harder for you to fight off certain diseases, and it also makes it more likely that you can have a serious complication from something that we think of as simple as the flu. It can become very deadly. So these vaccine-preventable diseases like the flu, they can increase the risk of another heart attack or even cause a stroke. Immunizations provide the best protection against these vaccine-preventable diseases. And vaccines are one of the safest ways to protect your heart. Even if you're taking prescription medication, even if somebody has told you they've cured your heart disease by putting in a stent, you still have heart disease and you need to be protected. And you need these vaccines. And although I know a lot of people will tell me, and a lot of my patients, we have these discussions that the side effects of the vaccines, often they are quite mild and they'll go away on their own. And severe side effects are actually very rare. And that's why we really push you and talk to you year after year to get your vaccines. Next slide. It's just some quick statistics so that you're aware. People who have heart disease have a 10 times greater risk of having a heart attack within 3 days of getting the flu. And even after the flu, they have a higher risk. So even when the symptoms of the flu goes away, because they had the flu, patients with heart disease have a much higher risk. And among adults that are hospitalized because of the flu, almost 1 in 2 of them are patients who have heart disease. The problem that we have for something that's very preventable is that about right now, our statistics say that really about only half the people who have chronic conditions, the people that probably would benefit the most from these vaccines, only 1 in 2 of them actually get their flu vaccine. Next slide. So who needs a flu vaccine? Well, in truth, everyone 6 months or older actually needs to get their vaccines. But the groups that are the most vulnerable, you can see listed on this slide. People over the age of 65, pregnant women. I know a lot of people sometimes think that they shouldn't get vaccines, but actually that's not true. Heart disease, patients living with heart disease and stroke is a group that we definitely want to get their vaccinations. There's other conditions that a lot of our patients also have, like diabetes, chronic kidney disease, some people with underlying cancers. We know people from racial and ethnic minority groups should definitely get their vaccines, patients with disabilities. So just really everyone should get it, but if you want to know the highest risk groups, they're listed here. Next slide. Now, when we ask physicians, who should get a vaccine, basically 100% of physicians say that they recommend the flu vaccine to their patients. The problem is, as I already told you, only 45% of US adults with chronic conditions actually get vaccinated by November. And this is data from a year ago. I don't know if it'll be better this year or not, but that's our hope. Next slide, please. And I will tell you, I'll take pride in this, that cardiologists tend to talk about vaccines a lot more than pulmonologists or even endocrinologists, as you can see here, which is great. That, we definitely recognize the protective effect of the flu vaccine and what it can do for our heart patients. Our goal is to keep you out of the hospital and keep you from having another heart attack or a stroke. So we are definitely on board with this, but we need to do better. I think that, these conversations need to happen. Even when I have a patient who the year before said they didn't want to get the vaccine, I still talk to them about getting the vaccine. I always think that this might be the year that I convince somebody who's scared of the side effects to go ahead and get it. Next slide, please. So this, like I said, vaccination is the best protection against the flu. For patients who have heart disease and stroke, they are the highest risk group. So I really strongly recommend this. And vaccination has been associated with lower rates of cardiovascular events with people with heart disease. So this is the reason. And then flu vaccines are updated each season. So that's why it's an annual vaccination. That's why just because you got it last year and then, is there a protective effect? Maybe. But again, every year the virus is a different virus. And so that's why every year in the fall, we try to figure out what's going to be the new vaccine. And that's why it changes. So you really do need one annually. And again, the CDC, the Center for Disease Control, recommends that everyone 6 months and older gets the seasonal flu vaccine. It's ideally best to get it before the end of October, but there's no time that is too late. So even if October passed and you just didn't get time to get it, go and get it. Next slide, please. Now, the types of vaccines for patients with heart disease, the flu shot, as we all call it, is really for it's the influenza vaccine. And that's the one that we're, focused on now as the fall is coming up. Now, there is a live attenuated vaccine form, the nasal spray, that everyone who doesn't like needles always asks me about. But to be honest, with patients who have heart disease should actually not get that form of the vaccination. So it can be for people who are not pregnant and people age 2 all the way to 49, but we don't recommend it for people with heart disease. But in addition to the flu shot, you should know if your other vaccines are up to date. And it's important to talk about this with your primary care physician or with your cardiologist or whoever your doctor is. A pneumococcal vaccine is an important vaccine to get, and it can protect you as well from a flu-related complications that are associated with death and are particularly, again, higher in patients who have cardiovascular disease. So that's an important one to get. Next slide. But this slide will show you other vaccines that you should make sure you've had if you haven't. So not just the flu vaccine, but also the pneumococcal vaccine, as I mentioned, but the Tdap vaccine. This is tetanus, diphtheria, and pertussis. If you haven't had it, this is something that you really need to get every 10 years. And then the zoster vaccine for anyone 50 years and older. And if anyone has ever had shingles, they will tell you, get this vaccine because it is one of the most painful things that you can deal with, and it can last for a very long time. So it's a good time to think about it in the fall if you haven't done these things to get them. And there's a new vaccine for shingles, actually. So even if you had the old one, you might still be eligible for the newer one. It seems to be more protective. So I think I would just leave you with our information from the American College of Cardiology. I used to be the editor of CardioSmart, and I made this up. And it's a great just sort of information slide or picture that you can look at, but summarizing basically what I said. And not to forget, get your flu shot. It's part of our preventive care, as is exercise, not smoking, eating a healthy diet, and taking your medication. You can get your vaccine at your doctor's office, and if they don't offer it, most pharmacies these days do. And if you really don't know where to get it, go to vaccinefinder.org because it will help you find a place near you. So again, thank you for letting me be part of this and talking about prevention.
Thank you so much, Dr. Gulati. So many useful, I think, tools and pieces of information. We'll be sure to pass that along once we wrap up this webinar. So now I'd like to introduce to you Abby Bownas. She's an expert in vaccine policy, a partner at the consulting firm NVG, and she is the co-manager of the Adult Vaccine Access Coalition, of which WomenHeart has been a proud member since 2019. Thank you so much for joining us today, Abby.
Wonderful. Thank you so much for having me. And that was just a wonderful first presentation. So really appreciate the chance now to connect some dots on the policy side, because I think it's really always amazing when we can have our voices be heard and hopefully make it easier for people to go out and get vaccinated in the future. So I'm Abby Bownas. I'm the manager of AVAC, the Adult Vaccine Access Coalition. We can move the slides forward, please. Thank you. And AVAC has been together since about 2015. We are so appreciative that WomenHeart joined us not too long ago. But we came together because what we realized is that the vaccine rates in the adult population, as you heard, are just far below where they could and they should be. And part of the reason for that is there's a host of barriers out there in terms of why people can't easily access these vaccines. And so we can talk a little bit about what some of those barriers are. And then AVAC has come in to really think about how we can try to remove the barriers through federal policy and legislation, and see if we can make the infrastructure for immunizations a little bit stronger and easier to access. And, basically the bottom line is, every year, tens of thousands of people either die or they're hospitalized or they miss work because they actually have vaccine preventable disease. And so again, we see a lot of really benefit out there if we can improve access and utilization and help keep everyone healthier and save society, those costs of people getting sick. So we have over 70 members at our coalition table now. We are a diverse group. We have providers, doctors, nurses, pharmacy. We have patient groups, public health groups. We have innovators that make vaccines at the table. And then some of the experts that work on things like vaccine technology and those data systems that help support the infrastructure overall. And really, as I said, we came together because we realized that perhaps together we could have a more powerful voice in terms of advocating for these changes on the policy level. And of course, so many of our members have members themselves. And so really, it is all of us working together that helps get some of this change. So I would just, thank you all for being part of this effort as well. Next slide. So again, adult rates are far below where they could and they should be. Recently, the CDC put out a report saying 3 out of 4 adults are missing at least one recommended vaccine. And so as you heard, those include flu and pneumococcal, shingles, or tetanus. There are different recommendations based on age and health status, but we really want to make sure when we can that we're staying up to date on which vaccines are recommended, and then going out and being able to get those. And so we have an opportunity before us to try to improve access to these vaccines. Next slide. And part of the additional challenge is what's just happened over the last couple of years. So during the course of the pandemic, we were talking a lot about vaccines, which was really amazing. And I think a lot of people know way more than they ever want to or needed to about vaccination. However, one thing that we didn't do was necessarily go out and see our providers or get our routinely recommended vaccine. So we actually left the pandemic being about 37 million doses behind routinely recommended vaccines. And this is adolescents and adults. We know our childhood population very similarly missed a lot of those routine visits at the beginning. And so now we're making a very concerted push on how to make sure to get people back in with their providers so that they can catch up. And, you know, part of that may be receiving more than one vaccine at once, or using an opportunity when you're in there getting vaccinated to talk about other perhaps missed vaccines. But really, we have some work to do in terms of trying to get caught up. And now is a perfect time to do it, especially as we are going into flu season, where it's a great time to go get your flu shot, perhaps with a COVID booster, plus whatever else. You can at least have that conversation and figure out what's missing. Next slide, please. So one of the additional challenges that we see is that it's not just across the board in terms of who is and isn't getting vaccinations. There's been longstanding disparities in terms of what populations have access to vaccines. And that's something that AVAC is very conscious of and really trying to think about. What is equitable access, and how do we make sure all populations, you know, whether that's geographic, socioeconomic, or racial groups, are all receiving and have access to the vaccines. This was some data from 2019, and it really, I think, really clearly showed what we're up against, right? Where we see for, I think this was the shingles vaccine, yeah, there are 2 times more white population receiving the vaccine. We see similar rates when we look at maternal vaccinations around flu and Tdap. And I think one of the really great things in terms of the very robust COVID-19 vaccination campaign is that we were able to defeat, you know, what we see in other vaccines and really create more of an even playing field. And so for the first time, we saw elimination of some of these disparities with regard to COVID-19 access. And I think that's what we want to look to and say, how did we achieve that? And how do we do that for other recommended vaccines now? Next slide, please. So I talk about barriers, but just to kind of acknowledge what some of those barriers are, because there's things in the adult space are complicated. You know, a lot of us see different providers, or a lot of us don't see providers at all. And we don't all know the immunization schedule. There's over a dozen adult vaccines out there. We may think that we've already had them when we were children and therefore not need them. So it's just figuring out, you know, what we need when. There's up until very recently, there's been financial barriers in terms of when vaccines cost more money. Oftentimes less people will access them versus having a free vaccine and making it really easy for people to get out there and get that. The diversity of providers overall, you know, you may not remember which vaccine you had when you were visiting your general practitioner, and then when you go see your cardiologist, should you get that vaccine? You don't want 2 of them. So the question is, how do we make sure different providers are tracking the information of, again, which vaccines? We want our providers to be making really strong recommendations and providing the education. People have questions, and when you're visiting with a provider, great opportunity to have those conversations with them. We also have data challenges in terms of some of those tracking systems. The immunization information systems is another area where AVAC's trying to figure out how can we make systems easier for everybody to use. And that way you can show up at your doctor's office, you can show up at your pharmacist, and they know which vaccine, so you don't have to. All that data gets connected behind the scenes. And then I think it's just how do we figure out how to, do the policy change to alleviate these barriers. And I think that's where we're trying to do one by one, different solutions and trying to just make the ecosystem stronger here. Next slide, please. So some of the policy areas that AVAC is focused on, again, is strengthening the immunization infrastructure. Infrastructure means a lot of different things, but helping our public health departments to educate and provide resources to on the ground, doing that tracking, that safety data, all of that good stuff comes as part of the infrastructure, as well as the immunization information system. So we throw out one term, which is infrastructure, but really there's just so much packed into that. Equity in vaccine access, access is in our coalition's name, but how are we reaching all population? How are we thinking about most at-risk individuals, people with chronic illnesses, where we have the opportunity to really make that recommendation ahead of time so that they can, so people can lead healthier lives. The financial barriers, which I'm really excited that we were able to really make some recent progress on in the Medicare space, as well as the Medicaid space, 2 federal health insurance programs. And then just generally promoting higher rates. How can we get back to where we were before the pandemic, but then actually have higher rates than even before, because we knew we weren't starting in a strong place. So wanted to just hone in a little bit on that financial barriers piece, because just as of a week ago, we really were able to make some tremendous progress there, and I'm excited to see that come to fruition. So one of the things that we know to be true is that if you are able to take cost away, it makes it much easier and available, and people are more likely to get that vaccine. Next slide, please. Great. And in the past, what we've seen is that in the private marketplace, all vaccines are covered. That was legislation that passed over a decade ago to say if it's a recommended vaccine by the CDC, individuals with private insurance do not have to pay for that vaccine. Similarly, in the Medicare program for those over 65, if a vaccine was covered under Medicare Part B, which is the general benefit, then there was no cost involved there. So for flu, for pneumococcal, that vaccine was free of charge for the beneficiary, and they could go and get it, and again, made it really easy. The way the law was written years and years ago was that if the vaccine fell under Part D, the pharmacy benefit, and actually after 2005, all vaccines fell, new vaccines would go into that category, then there could be costs involved. And those costs really vary anywhere between, free up to, $150 or more. And that was really a deterrent to receiving that vaccine, especially if you had a vaccine that had a 2-dose, recommendation, you got to go pay twice for it. So one of the things that AVAC's really been thinking about over the last 5 years is how do we eliminate that cost? And again, just last week, that very big bill that Congress passed, the Inflation Reduction Act, had a provision that was included that said no cost for vaccines for older adults. We're going to get rid of all of the costs involved in those Part D vaccines. So we are so excited for that. That's going to come into effect starting in January. And I think it's going to really be beneficial to us as we all advocate for immunizations in the Medicare population. And similarly, in the Medicaid space, so program for low-income individuals, it was determined state by state. And so you had certain states that had no cost for vaccines, and then other states where there just wasn't coverage. And with that came costs. And that's a population we really want to be thinking about how to reach. And so similarly, a provision in the IRA last week also said 3 things. 1, if it's a vaccine and it's recommended, in all states, it should be covered. 2, there should be no cost sharing for the beneficiary. And then 3, because we know there's some additional barriers for providers carrying those vaccines, we're going to do an increase in the technical term is the SMAP, but they're going to increase for providers to be able to carry and offer and stock those vaccines. So we're also very, very excited about that because we see that as a real opportunity to close the gaps in terms of coverage. And so really looking forward to those coming to fruition and then seeing how they go into implementation over the next months. Next slide, please. So that is where we'll leave it. I'm happy to answer any questions about any of the policy work that we're doing, and certainly about those two recent provisions. But thank you so much.
Thank you so much, Abby. I'm taking notes because I do want to ask questions of you at the very end. But I would also encourage those in the audience to put in the chat any questions that you might have, and we'll get to them as we've got time. So last but certainly not least, I want to introduce our WomenHeart champion, Beverly Thompson. Bev has been a champion since 2012 and joining us today from Texas. Bev, I'd like you to start off with telling us why it's important to you that we speak to women with heart disease about the importance of being vaccinated.
Well, as a person living with heart disease, and also a person who's had shingles and also COVID, I just got over COVID, and I have been fully vaccinated for, I thought I was fully vaccinated for COVID, but obviously this new strain took me down a little bit. But I also found out that I needed to be vaccinated for shingles, even though I had it when I was only 20 years old, and ended up being hospitalized for a week. And I know how terrible shingles is. So I talk about it with people. And in fact, I made sure my husband got his second shingle shot last week when we were in the pharmacy, because it is, and I learned a lot today from Dr. Gulati about just how tenuous it is living with heart disease and the effects that could happen. In fact, with when I got COVID the other week, my doctor put me on the Paxlovid and so on, because not only do I have heart disease, but I also deal with asthma. And so the respiratory part of it was an issue. I don't know if the Paxlovid made me feel so bad or if it was the COVID, but whatever, I finally was able to shake it after 4 weeks. So it's not anything to turn your head against. And so, and even though I have relatives who don't get vaccinated or won't get vaccinated, I still talk about it. And I think it's important that WomenHeart Champions, if they have support groups, to spend time on that. I know that when I've had my district meetings, that's always been a big discussion during the last 2 years about the importance of the vaccinations and have you gotten your shot and so on. And a lot of it, I wish there were like a badge that we could wear out in public, that people would ask about it, because sometimes, you don't have the opportunity to talk about it with someone. But I don't think that that's going to happen, but it would be a good idea.
Well, we will note that, Bev, and that's not a bad idea for WomenHeart Champions to have those kinds of badges. I like that idea a lot.
Mm-hmm.
What actions, Bev, have you taken to spread the word? It sounds like you try to talk to whoever you can about it. But what has worked for you to inform women in the community about both access and the need for vaccinations?
Well, with the last 2.5 years with COVID, I haven't had the opportunity to be out in the community with that. But I think on Facebook and, it's an easy way to just make a statement, have you had your, I was thinking as I was listening to Abby's talk, what I'll do differently now about, asking people, have you had your shingles shot? Or, and I had no idea that we needed to be doing the Tdap. And I hadn't heard that from my doctor. She's always very good about the, vaccinations and so on. But that's an easy way to do it when you're not out in the community. But now that COVID has, waned somewhat, I do plan to, do some community outreach. And I would like to see some slides added about vaccines to the WomenHeart slides that I would use in a presentation to talk about that. And then I could share, my own experience with that as well.
Absolutely. Yeah, that would be great. I want to also ask you, because since you mentioned Abby's presentation about disparities and barriers and policy solutions, why do you think it's important for there to be a patient voice in the advocacy work? Why should policymakers, make the time to talk to patients and have a conversation about solutions around sort of the barriers that we face, whether it's vaccinations or anything else in healthcare, really?
I think that they're not always aware of what those barriers are. And if you have people who are living in the trenches talking about some ideas that could happen, to get the underrepresented, Black and Hispanic awareness out there. And I do watch, commercials that are on television that, talk about shingles and other things. I think that who's producing those is doing a good job, because they will use people of color for that. But I think that lawmakers have a tendency to listen to the man on the street more so than a professional lobbyist.
Absolutely. I think that's right. And specifically folks from their districts, right?
Yes.
That's where we know it really matters.
Right.
So in terms of wrapping it up, and I want to bring Abby and Dr. Gulati back into the conversation, one question that I've sort of had brewing in my mind in listening to the three of you is, I'm sure that you have each faced, in talking to patients or others, you've faced folks that have been consumers of misinformation, and they sort of act on that misinformation by actively not getting vaccinated. So I want to sort of open it up and ask each of you, what kind of dialogue have you tried with folks like that, and what have you seen work? And maybe Dr. Gulati, if you can kick us off.
Well, I think obviously there is a lot of misinformation out there, and the internet is a great thing, but it's also sometimes the bane of our existence. And so one thing is to ask our patients their concerns. Why don't you want to get a vaccine? Yeah. Understanding their point of view and the information that they have on hand and countering it with evidence at least creates a dialogue between the healthcare community and our patients. And I think that's so important, because sometimes just that simple conversation of showing them what's actually the fact versus fiction can be the reason that somebody goes from your office from starting to say, I don't want a vaccine, to leaving, okay, let's get that vaccine over with. And it may not happen on the first time, the first conversation, but that's why I think it's really important to have these conversations again and again, because depending on how frequently I might see the patient, it might still be flu season and I still won't give up. But I also will respect their choices. Everything that we do should be a partnership. It's shared decision-making. I need my patients' voices to be valued. They're important and they're based on their experiences. Absolutely. But sometimes sharing the additional information that they couldn't get on the internet, can really be the reason that they'll change their mind. And in addition, I've had patients for years, several years I've seen them, they've always turned it down. And then a family member or a friend either has a heart attack from the flu or dies because of the flu. And they come in, they're the first in line the next year. So don't give up on our patients ever.
Yeah, I think that's great advice. Abby, can I turn to you? What have you seen? What have you experienced and what have you seen work?
Yeah, I mean, I think all of that advice was just perfect. I think the only things I would add that we're working on from policy side is how do we support providers to have those conversations, right? And so oftentimes that part of the conversation isn't something that doctors can get reimbursed for, right? So we want to make sure there's time and space for providers to be able to answer questions, because you think sometimes people are hesitant, but sometimes people have really good questions, and just having time and space to get those questions answered from somebody they trust will make all the difference in the world to be able to have that. So there's standards of care around adult vaccination, and it really says that every visit, again, just like Dr. Gulati just shared, you want to have that conversation about what vaccines the patient has had. Make a strong recommendation, vaccinate on the spot, or if you don't have that vaccine in your office, to refer them out to go get vaccinated elsewhere, and then put it in the immunization information system. So I think there's really a nice strategy in place, and then it's how do we help our providers to offer that. I think the other thing, and we learned this as a valuable lesson through the COVID-19 campaign, is how do we support organizations on the ground to be helping with this work, right? Groups like WomenHeart that are helping to share messages just like this, but then, you know, in the community, really localized, having conversations among peers and making those recommendations to each other. We know, we heard Bev talk about shingles as an example. We know from data that people are most likely to get a shingles vaccine if they've seen someone with shingles, somebody in their close circle. And so that idea of sharing, you know, something that perhaps we might not previously have talked about, but being comfortable to say, hey, I just had the flu and it was a terrible experience, and I'm definitely going to get my flu shot, and make a strong recommendation that my husband and grandchildren and everybody goes, and really just sharing that as a story, I think is also very powerful. So there's lots we can do. And then given that I'm an advocate, I'll just put in a plug to talk to your members of Congress and your local officials and your state officials, because I think more often than not, they're hearing from people who have bad information or are against vaccination. And so they think that that's where people are, when that's not the truth. The truth is that the large majority of our country is still very much understanding why vaccines are so beneficial. And so just having that like positive conversation can go a huge way to make lawmakers and decision makers realize that, oh, you know, that's where people are. That's helpful. I can vote to support vaccines overall. So so many different things, but thank you so much for the chance.
Great. And Bev, you spoke to it a little bit earlier about friends and family who aren't vaccinated, and you said, you know, you keep going with your messaging. Can you talk maybe about one example of that kind of interaction where maybe it has worked, or you have convinced somebody that they should get vaccinated?
Well, my sister-in-law was one of the ones who didn't, and she lost her hair from, you know, she got COVID, she lost her hair, she lost her sense of taste and smell for a really, really long time. And then I had a niece who, I don't think, she just hadn't gotten vaccinated yet, but she ended up in the hospital, you know, intubated, very, very sick. She, you know, lost her hair too. You know, it's you know, and so that has spoken volumes to the others who were actually an LVN who wouldn't get it, and so on. But, you know, as I think about other vaccines that I've had as I've grown up, I grew up, when I was 2, my sister got polio. And so I grew up with getting the polio vaccine, and we thought we had eradicated, and now you guys know that they've found it in New York, and it's scary that, you know, because we've had a generation of people who were anti-vax. You know, you'll get, you know, it'll cause Down syndrome and different things like that, or autism, I'm sorry. You know, the stuff that they use in the vaccines, you know, which is, you know, scare tactics. And anyway, and so I would talk about, you know, my experience with polio, growing up with someone paralyzed and having to, crutches and braces for her life, because she came just as they, developed that.
Wow.
And so
Yeah.
I grew up with vaccines, we had those, and then for smallpox, and which was eradicated, and excuse me. So, I've always been a person to do the preventative things, and I turned 76 yesterday, and
Happy birthday.
Thank you. and I'm doing fine, and I haven't had any negative side effects from, this preventative medicine. And so that's how I would address it, especially with polio. And
coming back.
Do that,
Yeah, absolutely. Well,
Yeah.
Thank you so much. Thank you to the three of you. Thank you for joining me to talk about this really important topic today. We are grateful to Pfizer again for their support, but also mostly grateful to you who've attended, because this is a topic that, again, it's not sexy, but it is so important and fundamental to our ability to improve the health of the general public. And so thank you so much for joining us. And please, if you could take the short survey that will pop up once you leave the webinar, that would really help us to make sure that we are better addressing any questions that you might have out there about women and heart disease. Thank you so much.
Thank you.